Doctors can swiftly identify serious health issues in elderly patients by observing specific hygiene mistakes. These seemingly harmless habits may quietly signal dangerous conditions developing in your body. Alarmingly, most seniors are unaware they're making these critical errors every day. In the next few minutes, I'll reveal 7 personal hygiene mistakes that doctors immediately notice in their elderly patients and explain how correcting them could literally save your life or the life of someone you care about. This vital information isn't taught in schools, is rarely discussed in medical offices, and is almost never covered in health magazines. Yet, it could be the difference between enjoying your golden years in good health or suffering from preventable conditions that rob you of your independence and dignity. Let me introduce Harold, a 75-year-old retired engineer who believed his personal care routine was perfectly adequate. Harold was a vibrant member of his community, playing golf twice a week and never missing his grandchildren's baseball games. During what he assumed was a routine checkup, his doctor spotted 3 glaring hygiene mistakes that revealed Harold had been developing a serious health condition for months without any symptoms. "I had no idea," Harold later confided. "I thought I was taking great care of myself. If my doctor hadn't noticed these small hygiene issues, I might not be here today." Today, I'll share exactly what those mistakes were to help you avoid Harold's frightening experience. More importantly, I'll provide practical steps you can take starting now. Simple changes that could add years to your life. Mistake 1. Neglecting oral hygiene. When was the last time you closely examined your toothbrush? Is it frayed or worn out? Are you brushing thoroughly twice a day? Poor dental care isn't just about bad breath or losing teeth. It's directly linked to heart disease, stroke, and even dementia. Geriatric specialists at Harvard Medical School have shown that bacteria from untreated gum disease can enter your bloodstream, triggering life-threatening heart conditions. Their research indicates that seniors with poor oral hygiene are 3 times more likely to develop cardiovascular problems compared to those who maintain proper dental care. Consider Sylvia, a 68-year-old retired school teacher from Oregon. For months, Sylvia dismissed her bleeding gums, assuming it was a normal part of aging. "I thought it was just what happens when you get older," she said. During a routine physical, her cardiologist discovered dangerous inflammation in her heart valves, caused by oral bacteria that had traveled through her bloodstream. The doctor warned that waiting just a few more months could have led to irreversible damage. To protect yourself, check your toothbrush today. If it's over 3 months old or shows wear, replace it immediately. Better yet, switch to an electric toothbrush, which removes 62% more plaque than manual brushing, according to studies from the University of Pennsylvania Dental School. Brush for a full 2 minutes twice daily. Use a timer if needed. Floss every night without fail, and never skip dental checkups, even if you wear dentures. Notice bleeding when you brush or swollen gums? These aren't normal aging signs. They're urgent warnings from your body. Don't ignore them another day. Mistake 2. Infrequent bathing and skin care. How often do you bathe? Be honest. Many seniors reduce bathing as they age, but your skin, your largest organ, can reveal serious internal problems before other symptoms emerge. Dermatologists at the Mayo Clinic caution that infrequent bathing in seniors often masks early signs of diabetes, liver issues, or cardiac conditions. Their studies reveal that nearly 40% of undiagnosed medical conditions in elderly patients could have been detected earlier through proper skin observation. Take Clarence, a 77-year-old retired postal worker from Michigan. Clarence bathed once a week, believing it prevented dry skin, especially in winter. "I didn't want my skin to get too dry," he explained. During an appointment for an unrelated issue, his physician noticed unusual skin discoloration, which led to tests revealing early-stage kidney disease. The infrequent bathing had hidden a critical symptom that could have been spotted weeks earlier. To avoid this, establish a bathing schedule of at least 3 times weekly, even if you're not active. Use mild, fragrance-free soap to preserve your skin's natural oils. After bathing, apply moisturizer to slightly damp skin to lock in hydration. Regularly inspect your skin for changes in color, texture, or persistent itching. Dry, flaky patches or unusual discoloration could signal serious internal issues. Don't wait to address these warning signs. Act promptly to protect your health. Mistake 3. Ignoring nail care. Take a moment to examine your fingernails and toenails. Are they neatly trimmed, clean underneath, and free from discoloration? Your nails are a window into your overall health, and doctors check them immediately in elderly patients. The American Academy of Dermatology notes that nail changes can indicate over 20 systemic diseases, including anemia, thyroid problems, and heart disease. In patients over 65, nail abnormalities led to diagnosing previously undetected conditions in nearly 30% of cases. Beatrice, an 82-year-old retiree, didn't think her thickening, yellowing toenails were a concern. She hid them in closed shoes, assuming it was normal aging. "I figured it was just part of getting older," she said. When foot pain forced her to see a podiatrist, the doctor diagnosed a fungal infection that had spread due to neglect, revealing a severely suppressed immune system. Further tests uncovered a serious condition requiring urgent treatment. To prevent this, trim your nails regularly, straight across with slightly rounded edges to avoid ingrown nails. Keep them clean and dry, wear breathable footwear, and change socks daily. Never ignore changes in nail color, texture, or thickness. These aren't cosmetic issues but potential health warnings. Are your nails brittle, discolored, or thickened? These changes signal something important. Act before it's too late. Mistake 4. Improper incontinence management. Incontinence affects over 50% of seniors, but many hide it, leading to severe consequences. Johns Hopkins urologists report that untreated incontinence causes skin infections, falls, social isolation, and can mask serious conditions like bladder or prostate cancer. Seniors who manage incontinence properly have 60% fewer complications than those who conceal it. Douglas, a 73-year-old retired accountant from Arizona, was too embarrassed to discuss his occasional leakage. He used paper towels and changed clothes often, thinking he was handling it. When painful sores developed, doctors found an advanced prostate condition that could have been treated earlier. "My pride almost cost me my life," Douglas admitted. If you're experiencing incontinence, don't be ashamed. Talk to your doctor, who deals with this daily. Use absorbent products designed for incontinence, not makeshift solutions. Change promptly when wet and follow a proper cleansing routine to prevent skin breakdown. Incontinence isn't a normal part of aging. It's a symptom requiring medical attention. Are you noticing leakage or planning outings around bathrooms? Don't delay. Speak to your doctor today. Mistake 5. Ear hygiene errors. What's your ear cleaning routine? Are you using cotton swabs deep in your ear canal? This dangerous habit, common among seniors, can damage hearing and miss signs of serious infections. Otolaryngologists say improper ear cleaning causes nearly 40% of ear canal injuries in those over 65, often leading to preventable infections. Patricia, a 71-year-old retired librarian from Washington, used cotton swabs until she punctured her eardrum, causing a severe infection that spread and led to permanent hearing loss. "No one told me it was dangerous," she said. Follow this rule. Never insert anything smaller than your elbow into your ear canal. Clean the outer ear with a warm, damp washcloth. For excess wax, use eardrops designed to soften it, following instructions carefully. See a doctor immediately for pain, discharge, or hearing changes. Itchy or blocked ears. Don't self-treat. Seek professional care to protect your hearing. Mistake 6. Poor foot hygiene. When did you last thoroughly inspect your feet? Between toes, heels, and soles? Your feet hold clues about your circulatory and nervous systems, and doctors check them first. The American Podiatric Medical Association says foot hygiene issues often reveal early signs of diabetes, neuropathy, or vascular disease. Proper foot care could prevent 85% of diabetes-related amputations in those over 65. Raymond, a 76-year-old retired factory worker from Illinois, ignored dry, cracked feet, assuming they were normal. During a routine exam, his doctor's foot inspection led to early diabetes detection, allowing lifestyle changes to prevent severe damage. Wash and dry your feet daily, especially between toes, to prevent fungus. Inspect regularly for cuts, sores, or changes in color or temperature. Wear clean, moisture-wicking socks and moisturize dry areas, but not between toes. Don't ignore pain, numbness, or slow-healing wounds, see a doctor immediately. Dry, cracked feet or discoloration? These are serious warning signs requiring attention. Mistake 7. Medication-related hygiene issues. Are you on multiple medications? Notice changes in body odor, sweating, or dry mouth? Medications can cause hygiene issues, signaling dangerous side effects. The American Geriatric Society reports that 40% of adverse drug reactions in seniors first appear as hygiene changes. Barbara, a 67-year-old retired nurse from Florida, had body odor mistaken for poor hygiene. Her geriatrician identified it as medication toxicity damaging her liver. "I was showering daily," Barbara said. "I didn't know the smell came from inside." Track hygiene changes after starting medications in a journal, noting odor, sweating, or skin changes. Stay hydrated unless advised otherwise, and report unusual symptoms to your doctor. They may indicate drug interactions. Never adjust doses without guidance. Unusual odor or excessive sweating? Don't assume it's aging. Seek medical advice. These 7 hygiene mistakes are critical signals doctors notice in elderly patients. Addressing them today can prevent serious health issues, maintain your dignity, and extend your life. Hygiene isn't just about appearance. It's vital for health. If this was valuable, like this video. Has your doctor flagged these issues? Share in the comments. Subscribe and hit the notification bell for more life-saving tips. Share this with loved ones over 60. It could save their lives.